Hi everybody, my name's Taylor, and for this second part of the Chapter 11 assignment, I'm going to be looking at osteoporosis and how that will affect exercise. So first off, what is osteoporosis? Osteoporosis is a skeletal disease that is characterized by low bone mineral density and changes in the microarchitecture of bone that increases the likelihood of bone injury and fracture. So pretty much our bone is very compact and it's very firm. When you have osteoporosis, you get huge pores in that bone and that density decreases. And I have a picture in a further slide that will kind of show you what that looks like. It's more prevalent in women, so 1 out of every 2 women will actually develop osteoporosis at some point in their lifetime. It can still affect men though. 15% of men do have osteoporosis, but again, it's a lot more common in females. More than 54 million individuals in the U.S. have osteoporosis or low bone mineral density. So low bone mineral density will eventually cause osteoporosis. It's just not severe enough to be termed osteoporosis yet. Causes increase in all-cause mortality 5-fold for those that experience hip fractures due to osteoporosis. So people that have osteoporosis have a higher incidence of falls, just because sometimes their balance will be a little bit off. And when they fall, they have a higher chance to have a fracture just due to the bone obviously not being as dense and compact. So a lot of times these people will have hip fractures, and that turn will also usually cause other issues and also sometimes cause death due to the severity. So symptoms and risk factors of osteoporosis. First off, the symptoms. If you are in the early stages of osteoporosis, you will not have any symptoms. So a lot of people don't realize they have anything going on until they have a fracture. So usually a fracture is the first incidence that will be seen that will make someone go to the doctor and find out that they have osteoporosis. Another symptom that is common is receding gums. Your teeth are bone, so it affects your teeth as well. Weakened grip strength. So a lot of times in assessments, we'll look at grip strength. That can usually be a good sign if they had really good grip strength a few months ago and now it's declining at a significant rate. That could be a sign of osteoporosis. And also weakened brittle nails. So those are the symptoms to look out for. Risk factors. The most common risk factor is age. So as we age, our bone breaks down faster than it builds. So obviously that's going to impact the density. Gender, again, it's more common in females than men. So females, just being female is a huge risk factor. And then menopause. So once women go through menopause, their estrogen levels drop, which in turn usually drops their bone mineral density. So women that have gone through menopause, usually over that age of 55, are going to be at a higher incidence of osteoporosis as well. It does run in families, so you can have a genetic risk factor that will make you more susceptible to developing osteoporosis. Physical inactivity, doing weight-bearing exercises will increase bone density. So if someone's inactive, they're not adding to that bone density. It's just going to be all based on what their body's creating. So those that are physically inactive have a higher incidence as well. Smoking causes a lot of things, so it also causes osteoporosis. And then also low body weight and poor nutrition. There has been cases of osteoporosis seen in younger females that, for example, had an eating disorder, and also males. So if you're not getting proper nutrition, calcium, all that stuff, your bone density is going to go down due to not having adequate nutrition. So how do we diagnose osteoporosis? So usually osteoporosis will be diagnosed through the use of a BMD scan, so a bone mineral density scan that is seen on an x-ray. Again, I have pictures of that and I'll kind of show you what that will look like. But the International Society of Clinical Densitometry defines osteoporosis as in postmenopausal women and in men over 50 years of age as a bone mineral density T-score of the lumbar spine, total hip, or femoral neck of less than 2.5. So the chart at the bottom kind of shows you what that T-score looks like. So normal bone density is anywhere between a 1.0 to a negative 1.0. So that's really good bone density. The number starts to decrease. So once you get to that negative range is where you start to have some issues. So low bone density is anywhere between a -1 to a -2.5, and then high risk for osteoporosis is 2.5 or higher, negative. So again, low bone density doesn't mean that you have osteoporosis. It's just a good sign that you're getting close to having an issue and being diagnosed there. Also, the National Bone Health Alliance created even further diagnostic criteria to include those with osteopenia who have sustained a low trauma vertebral, proximal humerus, pelvis, or distal forearm fracture, or have an elevated fracture risk per the World Health Organization fracture risk algorithm. So again, if you have osteopenia and you've had a fracture and you are at an elevated risk for having a fracture, you can also be diagnosed with osteoporosis without having that really low T-score in your bone density scan. So again, I was going to show you what does osteoporosis look like. Let me move myself here so you can see. The top picture is a picture of a knee. So on the left-hand side, you'll see a healthy knee with healthy bone mineral density. If you look on the right, you can kind of start to see through it. So when you're able to see through a bone, obviously there's less density there. So that's a healthy knee compared to a knee that has osteoporosis. On the bottom left corner, you'll see a hand. Same thing. You'll see how it's a lot easier to see through. There's not as much of that dark white. There's no density, and you can see how it kind of moves all the way up the hand. It kind of goes into the wrist and forearm as well. And then this bottom right picture gives you an idea without an x-ray of just what it looks like. Again, I was telling you about how the bone starts to look more porous. So as you'll see, a normal bone matrix is very compacted. If you look at the osteoporosis picture beside it, you'll see that there's a lot more holes. Therefore, fractures are very easy because there's not much to go through. So exercise testing considerations for those osteoporosis. So normal testing procedures can be followed, but you must consider the following. So use of cycle ergometer as an alternative to a treadmill for those with severe vertebral osteoporosis, which has caused pain while walking or standing. So some people that have osteoporosis, they may not be able to stand for large periods of time because of all the vertebral damage that is going on in their spinal column. So instead of using a treadmill, it'd be best to use a cycle ergometer or something sitting down to take some of that pressure off that lower back. Multiple vertebral compression fractures leading to a loss in height and spinal deformation can compromise ventilatory capacity and result in a forward shift in gravity, causing issues with balance during treadmill walking. So we talked about this earlier, how these people have a higher incidence risk of falls. So treadmill walking shouldn't be used in those that have severe osteoporosis because usually the more severe cases have more of that balance issue. So again, kind of staying away from treadmill walking and using other forms such as a cycle ergometer. Maximal muscle strength testing, so for example, one rep max may be contraindicated for those with severe osteoporosis. So you don't want to put a lot of strain on the bone because again, of that fracture risk, we don't want to increase that. And then use of balance testing and a fall risk assessment should be considered for this population. So doing that in your pre-health screening will help with that. Looking at their balance, let them balance on one foot, make them close their eyes, then doing a fall risk assessment. Those will be very important. And then that kind of gives you a baseline as to if walking a treadmill would be safe for them or if it wouldn't be. So those are two tests to keep in mind during their pre-exercise assessment. So exercise training considerations. So there's actually not a lot for this population. There is little evidence available regarding the optimal exercise regimen for individuals with osteoporosis. So because of that, there's not a ton of research about it. The best option that they've come up with is the use of weight-bearing aerobic exercise in combination with some form of high-impact, high-velocity, high-intensity resistance training. So using weight-bearing aerobic exercise, that can be through things such as adding a resistance, using a new step, which is a seated stair step. That's a good option because it will add that resistance, and it also uses their arms and legs at the same time instead of just using just their arms or just their legs. It'll also increase their heart rate, but also give them a weight-bearing component. And then high impact, high velocity, high intensity resistance training. High intensity has actually been shown to be very beneficial for these people if it is tolerated. So obviously don't make them do it if it's not going to be something that they handle very well. And again, the more severe cases of osteoporosis, that's where you're going to see more issues with that. So just kind of base it on who you're working with and the severity of their case here. So a fit recommendation for individuals with osteoporosis. So when it comes to aerobic training, you're going to want to do 4 to 5 days a week of intensity of a RPE of 3 to 4 on that CR10 scale. You're going to want to begin with 20-minute increments and then gradually progress to a minimum of 30 minutes. You never want to go over 45 to 60 minutes. That's going to be your max, just because that will cause more issues, especially if they have some vertebral osteoporosis there. There might be some pain and that kind of thing. Type of aerobic exercise can be things such as walking, cycling, or other individually appropriate aerobic activity. Again, adding that weight-bearing component will be important there because that will help increase bone density. When it comes to resistance training, you're going to start with 1 to 2 consecutive days a week, may progress to 2 to 3 days a week. So consecutive is fine here. You can go one day after the other. That's fine. And then again, adding a day or two in there as they progress. You're going to want to adjust the resistance so the last 2 reps are challenging to perform and high intensity is beneficial if tolerated. So we talked about the high intensity. You want to have a resistance so if they're doing 10 to 12 reps, that they're like by the 10th rep, they start to feel a little bit and it becomes a little bit more difficult. You're going to want to begin with 1 set of 8 to 12 reps and then increase to 2 sets after about 2 weeks. So you don't want to progress too quickly with them. Let them get used to that weight training component before you add another set there. And then you want to do no more than 8 to 10 exercises per session. You don't want to do too much. You don't want to put too much weight bearing on bone that has low density. Standard equipment can be used for resistance training with adequate instruction and safety considerations. So working with a fitness professional is important here, just to make sure that they have proper form and technique, because sometimes with osteoporosis, their posture can be greatly affected, just depending on the severity, so proper form is important. And then when it comes to flexibility, 5 to 7 days a week. So flexibility is going to be very important for these individuals just because they might be super tight and compressed because of their bone density. You're going to want to stretch to the point of tightness or slight discomfort. You're going to hold a static stretch for 10 to 30 seconds and then do 2 to 4 reps of each exercise. So for the general population, we usually only say to go through it 1 or 2 times. With this population, you want them to go through it a little bit more, again, just to kind of make sure that they're not getting super tight. And then static stretching of all major joints is the type you want to do there for flexibility. So make sure you do every joint, especially those joints that might be greatly affected by their osteoporosis. So then unique considerations for people with osteoporosis. You want to make sure they use proper form and alignment, and that's going to be more important than the exercise intensity, especially if they have fractures previously. So again, as a fitness professional, make sure that when they're lifting weights or doing aerobic activity that their form and posture is correct. Therefore, that's going to cause less risk of injury or fracture. There are currently no contraindications to exercise, so that's good for this population. Exercise should not cause or exacerbate pain that is due to the condition. So you don't want to make their pain worse. These people are most of the time already going to be in pain and just due to a lot of the compression that they have. So if they come to you and they're having more pain than usual, it's best to pinpoint that because that shouldn't be happening. No high impact loading or explosive movements, so no jump squats, nothing crazy like that. That's going to increase that risk of fracture. And then also, with their increase in falls, doing movements that they're jumping or being explosive can increase that fall risk. And then you want to be careful with exercises such as Pilates and yoga due to twisting and compression of the spine, especially in those with vertebral osteoporosis, just because that can cause more issues with the back there. Include activities that improve balance. The main muscle groups that you're going to want to target to do that are going to be the quadriceps, the hamstrings, the glutes, and the trunk and the abs. So by targeting those groups, that's going to help improve balance. And then also just doing balancing activities. So standing on one foot, touching your nose, all that stuff. So that's all going to help. And then modifications based on professional judgment may be necessary. So again, just like what we do every single day, no case is going to be the exact same. So you need to be able to judge professionally what these people might need and what's going to be safest for them. So that's my last slide, and that's all I have, and I hope this helped you learn a little bit more about osteoporosis.